Hi, and welcome to the Women's Handbook podcast, How to Be a Woman, where we talk about everything women's health, real advice for real women at every stage, from menarche to matriarchy. I'm your host, Dr. Natalie Hutchins, and today we are talking to Annelise Lai. She is a psychologist experienced in caring for teenagers, and she's got a special interest in eating disorders. Now, we all know that the mental health challenges our teens are facing are at an all-time high at the moment. There's been such a huge increase in anxiety, depression, and eating disorders in the past decade. In fact, hospital admissions relating to eating disorders have nearly doubled in the last 10 years. And although adolescence is a stage where we start to see a rise in these conditions in both boys and girls, mental health disorders start to affect girls at a much greater rate than boys during the teen years. So Annelise and I are going to discuss how you can spot the early warning signs, how to tell it apart from just normal teenage behaviour, and how you can support them through it all. And I hope it reaches any parent or teen that needs to hear it. Even though we do focus on teen girls, a lot of the information in this episode is applicable to boys as well. So please still have a listen if you are a boy mum. So let's get started. Hi, Annelise. Thank you so much for coming in today. How are you?
I'm good. Good to see you again.
And good to see you. So would you mind telling the listeners a little bit about you and what you do?
I'm a clinical psychologist and supervisor in private practice, the other clinic. I see older teens and adults with a wide range of psychiatric condition like depression, anxiety, but I have a special interest in anxiety-related issues and eating disorders, and I do a lot of childhood trauma, relational attachment trauma, and true inner child work.
Wow.
And healing your inner child. Yes.
I can't wait to get into that a bit later. But I mean, you obviously see a lot of teens and you're talking to them, you're working with them, you're caring for them. What are they saying? So what do they feel that some of the issues are that that might be behind this rise in mental health disorders in our teen girls?
I think diet culture and the use of social media could probably intensify this.
Yeah.
But body image dissatisfaction has been there for decades or centuries.
Definitely.
You know?
It was definitely there when I was younger, and I'm sure it was when you were.
Yeah.
Yeah.
It's not caused by social media, but it does provide a platform for comparison, and it really affects your self-esteem.
Yeah.
You know?
Yeah, absolutely. And what about kind of friendships and things like that? I mean, I think that's a really kind of difficult time to navigate with teen girls in particular. Like, how do you find that has a role to play in mental health disorders in teen girls?
I think that you get to ruminate a lot more because in the past, when you don't live and grow up with social media, it's pretty much contained in the classroom, and you go home and you get to go back to a safe place. But with social media, whatever that you hear from people, whatever is out there, the digital footprint is actually forever. And you get to continue the bullying, the comments, the comparison that really intensified anxiety.
Yeah, absolutely. I mean, you mentioned diet culture, and one of the things that I've been seeing on social media, and I'm sure you have as well, is this what I eat in a day trend. And I just, often you see these videos, and often it seems as though some of the women anyway, they don't seem to be particularly healthy in terms of their weight. Yes. And you just wonder how much of that is going to affect teen girls looking at that, thinking, well, I want to look like that, and this is how much I should be eating. And I look at what they're saying they've eaten in a day, I think, my goodness, that's nothing. How do you survive on that? So how do you think those types of trends affect teen girls as well?
I think I see both under-eating or healthy eating, or maybe overeating a little bit on that kind of trend. Some people do try to portray that body positivity, that you could do this, you don't have to eat very little, and some of them have like nutritionist credential as well. Yeah. So it really depends on what content and what accounts they choose to follow. Yeah. They are also a group of influencers who are maybe pro-anorexia, for example. And if you are seeking out that content, it can be really dangerous. Yeah, comparing yourself to someone who is actually unwell.
Absolutely. Do you think it's that the link between social media and teen girls' mental health? Because it does seem to be worse for teen girls. Do you think it's that teen girls who already have problems with their self-esteem and their body image, or even feeling low and a bit depressed, actually then go onto social media to try and seek out more of that? Or is it that they're going on and stumbling across this content, and then that makes them feel bad about themselves.
Right.
Which way do you think it is? Is it girls seeking out this content, or is it the other way?
I think it's a chicken and egg thing, right?
Yeah.
But developmentally at this age, they are struggling with their self-esteem because they're increasingly more self-conscious. The reflective self-consciousness is much higher as a teenager. And they develop that earlier than boys as well. And I think when you seek out comparison in real life, and then there's so many samples on social media that really becomes convenient for you to compare, and you tend to compare with not really homogeneous sample, but everyone with different genetic, different ethnicity and cultural background.
Absolutely.
Yeah.
Okay. And I think the other thing that, as a mum of a teen girl, that seems to be so prevalent as soon as they hit secondary school is the friendships.
Yes.
I mean, they tend to just come with so much drama. And that can cause issues with self-esteem and feeling like they don't fit in, and lots of unhappiness. How can we kind of get teen girls to kind of find their place in their friendship group? How important do you think that is?
It's so important. And I do agree with you. This is such a big problem. A lot of the teenagers that I used to see, they all have friendships problem. I cannot think of anyone without friendship problems.
Right.
But this is also a developmental task that they want to fulfill, to fit in, to kind of find your place in the society. So how do we help them find the right one, or one that fit? Would really depends on how comfortable they feel in their own skin. Yeah. Everyone wants to join a popular group, but there's only one group.
Absolutely. Yeah. Okay. So just moving on now to the actual conditions, because one of the things that I would really like parents to be able to get from this podcast is that if they have a child experiencing mental health concerns, that they're able to spot the signs early. And actually get the help that their child needs. And I think sometimes it can be difficult because everything's so much is changing in the teenage years, right?
They often ask, is this just a teenager
Exactly.
problem?
They're staying in their bedroom. Is that because they're just a teenager, or is that because they're depressed? So I'd love to talk about some of the conditions. So let's talk about depression. Does it present differently in teen girls or teenagers, full stop, to the way it does in adults?
A lot of time, teenagers, they express that sadness as more of anger outbursts.
Right.
And you might notice irritability increase, and not so much of the sadness and the crying.
Right.
Yeah, you might see them talking to you with a lot of attitude, or slamming the doors.
Okay. Yeah, that feels a little bit normal.
A lot of you don't get it.
Yes.
Yeah.
Okay. But I suppose it would, so obviously that can be normal for teens anyway, but I suppose you're saying that it would be kind of intensified in a child who is depressed, or kind of more persistent.
I would say.
Okay.
Yeah, maybe the size of the problem is smaller than the size of the reaction.
Right.
Yeah.
Okay. And what about anxiety? How does that kind of look in a teen compared to an adult?
In anxiety, it can look quite diverse, I would say, but a lot of them, they are less likely to tell you what exactly is running in their head.
Right.
And they're more likely to tell you about somatic symptoms. Like, I feel like I can't relax. I'm really restless, or, I can't sit still. I'm worrying about something, and in a more rigid way, I can't stop thinking about it.
Right. Okay.
Yeah.
And might they also have problems with their sleep? Might you notice issues like school refusal, not wanting to go to school, that type of thing?
Yeah. Sleep is a problem. And they might be anxious about academic, their grades, and they're staying up to make up for it. Yeah. So it's a compensation, for not doing well, they think.
Okay. Yeah. Do you see that a lot in children? Is that one of the things that they're coming in and saying, actually, the reason why I'm feeling like this is because schoolwork and academic pressures have become too much? Is that a thing?
Usually it's the parents who tell me that. They don't find their sleep as a problem. Usually they feel like it's quite normalized. I have so much work to do. The only thing I can sacrifice is my sleep to get them done. And everyone is doing that, Everyone is staying up late. Yeah.
Okay. And I think it can also be really difficult for parents because obviously feeling anxious sometimes is normal. We all feel anxious.
Yes, we all
feeling
do.
sad, feeling a bit low sometimes is normal. Having tough times in your life is normal.
Yeah.
So when does that stop becoming normal and when does sadness stop becoming normal and becomes depression? When does feeling a little bit worried about something stop becoming just being worried and actually become anxiety? How can we help parents understand that a bit more?
We can think about two things. So firstly, the intensity of how they're feeling and the distress it's causing them, and whether or not it impairs you enough.
Got it.
Secondly is the functioning, whether or not this has affected their functioning. For example, you talk about school refusal. They're not able to fulfill this task that they're supposed to, and the only role they have as a teenager is to be able to go to school.
Yeah.
For adults, we talk about employment, whether or not they're able to hold employment, to hold meaningful relationships. So that's something we look at for teens as well, whether or not they have friends,
Okay.
they go out,
Yeah.
their grades, whether or not they are dropping suddenly from where they used to be. Yeah.
Okay, that's really, really helpful. And I think also at this time, you start to see more self-harm. And I think maybe for some parents, it might seem as though, obviously it's very distressing if you've got a child that's harming themselves, but it can be difficult to understand what's going on there. Why are they doing it? And some people may even think it's kind of like a cry for attention. What is going on in self-harm? Why do children go down that route?
I always tell parents every time I see someone like that to reframe that in your head, that it's not attention seeking, but connection seeking.
Right. Oh, that's powerful. Yeah.
Yes. Self-harm is a way to express their feelings when they can't hold it in. We talk about the size of the feelings and the size of the reaction. So when the size of the feelings has become so huge, they can't contain it anymore, they have to find a way to release that.
Okay.
And self-harm is just an expression of how much distress they are feeling inside. So
when the distress gets to a certain point,
they
feel like they can't express it, they can't talk about it.
Or they can't cope. Their usual coping doesn't work anymore.
Okay. But how does, how do you explain how harming yourself, actually causing yourself pain, makes them feel better? What is it about the harming itself?
Yeah, this is something that parents really struggle to understand and struggle to empathize. So they get really upset.
Yeah.
Like they feel personal as well. Like I gave you this body and you're harming it. So there are different reasons why people are doing it. Firstly, it can be a really strong distraction.
Right.
So scrolling on TikTok doesn't distract you enough, but the pain on your skin can distract you from the pain that you're feeling inside.
Got it.
Some people do that as a punishment. They feel so bad about themselves, like the self-loathing voice is so strong. They feel like they have to punish themselves to quiet that noise in their head. That's also another reason.
Right, okay. That definitely makes it make more sense. And is it that, so if you've got a child who's self-harming, what is the relation between that and kind of suicide risk? Is this something, if you notice your child is cutting herself, I imagine that all parents would take it very seriously, but how serious is serious? How quickly do I need to act on that?
Right. They're not the same thing, self-harm and being suicidal, but sometimes it can escalate to thinking about ending your life. But if they're just cutting to explore how to release their distress, or they're trying to connect with you, they're trying to seek help, it usually doesn't mean that they're trying to end their life.
Right.
When we think about suicide, we think about passive suicidal thoughts or active suicidal thoughts. So passive suicidal thoughts could be death wish. Like, it would be so nice if I'm not here, I don't need to deal with all of this. But they have no intent. They're doing that as a way to escape from their reality, the distress that they're feeling. But if they are planning about, ending their life, they have written letters, they have talked to people, given stuff away, that would be more serious, and we need to take that seriously.
Absolutely.
Yeah.
And do you find actually that it tends to be, so the young people that you see who are self-harming, it tends to be more of the passive variety. Is it quite common that those children are actively thinking about suicide or not?
More of them are on the passive one. They do think about suicide, but they don't have strong intent or plan. A lot of them might be thinking about maybe at what age I would do it. So that would be a golden period where you can hold them. And I usually tell them, okay, since you have said it at 18 or 21, before that, can we maybe make your life a bit more tolerable until you can do what you want to do, just to stall that, you know?
Yeah. I'm sure parents listening will want to know what they can do to help. If you've got a child, obviously you would go and see, your doctor, you take that child to a psychologist, a psychiatrist if needed, if your GP thinks that referral is needed. But, sitting at home, it can be really difficult to know how to support a child who's self-harming. What would your advice be for that?
I feel a lot for parents because it's your parental instinct to want to step in, to want to bring them out of that cave, But a lot of time, you can't go into the cave without being out there and showing that you're here. And maybe encourage them to take the steps out of the cave rather than you going in.
Right.
So firstly, managing your own reaction is the most important.
Okay.
It will bring up a lot of your own feelings and anxiety. And, the worst case scenario keep playing in your head. Yeah. But being a calm presence is exactly what they need. Because of the chaos they are already experiencing inside, they really need you to be a calm and steady presence. Yeah.
Easier said than done, but absolutely it's so important, isn't it?
Yes. Taking turn would be really helpful. With your partner.
Okay. Yes, of course.
Yes, you don't have to always be that person,
And how hopeful can you be? So if you've got a child who's got severe anxiety, severe depression, is self-harming, maybe is having suicidal thoughts, how often do you see that if they engage with therapy, they go through the process with you, that actually they do end up feeling well and better and able to engage in their schoolwork and have friends, etc.? How much do you see them recover?
Actually, a lot of them.
Good.
And the key is actually the system.
Yeah.
Because they do live in a system, their family, their friendships, and then the bigger system is their school and then our society. Even though we can't change the biggest, which is diet culture, right? On the societal level, we can provide that safety from their smaller circles. So parents, friendships, schools, they can do a lot to provide that bubble. That sense of protection.
And would you say that self-harm, because you mentioned self-harm being kind of an expression of these negative feelings, this chaos inside, would you say that eating disorders are also that expression just done in a different way?
Yes, definitely. I believe eating disorder is a way to cope with whatever that you're feeling. And there is a theme of control as well. The more chaotic your life is, the more you're gonna reach out to eating disorder. It's like a frenemy. So they often find it really hard to let go because it was developed at a time where eating disorder gave them so much comfort and security.
Yes.
It could be parents going through divorce, a lot of instability in their life, can be a lot of movement, moving countries, and feeling neglected when another sibling is struggling, or just bullying and a lot of body-related comments growing up. Yeah.
So it's not just about diet culture wanting to be thin. It's more than that.
Yes. A lot of people, they misunderstand that and they don't like to work with this condition because they think that they're just being vain. But there are a lot of trauma that people actually go through. And there are a lot of attachment trauma especially.
Right.
Yeah, relational trauma especially.
And just speak to that a little bit. So is that with the parent?
It can be with the parents, and as a teenager, that's the primary relationship you have, and you have spent most of your life with your parents. It could also be with friends.
Okay.
Yeah.
Okay. So let's talk a little bit more about eating disorders then. So when people speak about eating disorders, I think most people will think probably of anorexia. Is that the only eating disorder? What are the different types? What does it mean?
Yeah. Anorexia is what we know because that's what is portrayed on media the most.
Yeah.
Because it's dramatic, it's visible, but that's not the most common eating disorder.
Right.
If you think about eating disorders, you can think about the term being an umbrella, but there are different subtypes. Anorexia being one of them. We also have bulimia. We also have binge eating disorder. We actually have a lot more in the DSM-5.
Okay.
And the most common one is actually the other specified feeding and eating disorders, meaning people who have all these symptoms of like anorexia, bulimia, binge eating, but they don't fit into the criteria as neatly.
Yes.
And that could be like atypical, where you have atypical anorexia, you have all of the symptoms. You have severe disturbance and attitude towards food, but because you lost so much weight from a heavier weight, you are not currently underweight yet.
Right.
So you don't qualify for that.
And that's one of the myths, isn't it? Is that a lot of people will think, well, actually my daughter or my daughter is normal weight and I see her eating, so she can't have an eating disorder. But that's not quite true, is it?
No, not at all. And a lot of even medical professionals, they miss the sign because we are so trained to identify heavier weight as a health risk, but not a lower weight. Yeah, and a lot of people with anorexia, they have high cholesterol, and then they were told to lose more weight, to exercise, and then the anorexia get missed completely. Yeah.
Yeah, okay. And how does anorexia or eating disorder differ from orthorexia, differ from kind of disordered eating? So there are quite a few terms. So can you explain that?
We can think about that as a spectrum. So disordered eating is on the same spectrum between normal eating and eating disorders. So everything in between that is disordered eating, like dieting or changing the way you eat, attempting different types of diets, they're all in the middle, but not everyone develop an eating disorder.
Right.
Yeah.
Okay. But would you say that if someone's displaying signs of disordered eating, they're at a greater risk of developing a full-blown eating disorder? Is that right?
Yes.
Okay. So now how would you define disordered eating? So what, as a parent, what am I looking for?
Right. So you can think about thinking, feelings, behaviors. These are the three things. So in terms of thinking, they might become really rigid. So I shouldn't be eating this, and they have cut that down completely. Maybe a certain food group like carbs or oil or sugar.
Yes.
These are the common ones. And then they become competitive. They start to compare how much you're eating versus how much they are, and constantly trying to eat lesser than everyone else.
Right.
Yeah, so the change in their thinking pattern, they become more obsessive about anything food related. It may not be about eating, but, collecting recipes, watching videos online, cooking a lot more but not eating them, baking a lot more but not eating them.
Right.
Yes.
Okay.
I've seen food hoarding, even though that's quite rare, as a form of obsessiveness. And then in terms of emotion, actually, a lot of people think that eating disorder is about guilt after eating.
Yes.
But it's actually a lot of anxiety.
Right.
Anxiety is a very big one. They are trying to control because that's anxiety management tool, controlling.
Yes.
Right?
Yes.
Create certainty. They might be planning for meal ahead, trying to cut down so that they can eat more later. If they know that there's a family meal, they're going to eat. They might skip lunch, for example. So that's the change in their behavior. They're more compensatory behavior, more restrictive behavior, maybe increase in exercising.
Yes.
Yeah.
Yeah. And apart from the exercise, the compensatory behaviours that you see, do you see laxative use as well? Do you see also
Purging.
kind of yes, exactly. Do you see all of that mixed in with one? I think a lot of people will think of anorexia, they'll think of bulimia, they'll think of everything being separate, but actually these things can merge into one.
Yeah. Actually, in research, they have been telling us that actually they are less neat as we thought. They are actually transdiagnostic.
Right.
You can have anorexia and then, shift to bulimia and then binge eating and then maybe back to anorexia at some point in your life again.
Yeah.
And
help us understand what's going on in the brain when a child with anorexia is looking in the mirror, because it can be really, really difficult for us seeing them without anorexia, without that brain. And they look so thin, but they look in the mirror and don't see that. How does that happen?
Okay. This is a really important point because they have distorted perception about their body, and it's not their fault.
Yes.
Anyone who is under eating, it affects their brain health. So that is coming from a very malnourished brain. What they're telling you, they often tell you that they're feeling great. Even at a very frail or, you can see that they're not functioning, not focusing. They would still be telling you that I'm doing great. I feel strong and energetic. So if you have such a big distortion or discrepancy between how you view them and how they view themselves, it's almost like a delusional state that they're in. It's really important to seek professional help. Yeah.
Okay. And is that the same as being someone who's got body dysmorphia? So if I've got anorexia and I'm looking in the mirror and I think I can see someone who's overweight when actually I'm very thin, is that the same as body dysmorphia, or is that something different?
Body dysmorphia is actually a completely different condition.
Right.
It's characterized by this obsessive thinking, but the perception of your body is not being viewed as a whole, but more of a certain part of your body. So they're obsessed about certain parts of their body not being perfect. And it could be your eyes not being symmetrical. Right. It could be your nose being crooked, your belly being bigger than you think it is. And skin condition is one. So they scrutinize their acne, scars, bumps on their face. And we all have textures on our face, which is normal. So what they're seeing is not always delusional. They're not always seeing things that are not there.
Right.
Sometimes they're there, but it's a very amplified version of what it is. And the reaction as well.
Okay.
So the behavior is different from the anorexia behavior. There's a lot of checking, a lot of concealing, correcting behavior. Yes. And the more they do that, the more they believe that they have to.
Right.
Otherwise, anxiety, cannot be managed.
Understood. Okay.
Yeah.
So as a psychologist, obviously, if you've got a teen who has showing signs of an eating disorder, GP's involved, maybe a psychiatrist involved, and obviously a psychologist is involved as well. What would you say, what's your role? So what type of thing are you doing with that child to lead them on the road to recovery?
Right. So a GP would be taking care of the physical health aspect, and so is the psychiatrist. They are able to prescribe medication. And as psychologists, we help them understand the whole problem and help them formulate the whole problem, usually map out the cycles using a biopsychosocial model where you look at the biological factor, family history, their own temperament, and then psychologically, how are they like, what are some of the risk factors like perfectionism, their stress tolerance, their self-esteem, and then the social factor like family environment, family dynamic, school, friendships, all of that, how they interact with different factors.
Yes.
Yeah.
I think any parent listening to this would just be, and if you've experienced having a child with an eating disorder, it comes with a lot of guilt and feeling like, what could I have done to cause this? How could I have contributed to this in some way? is that something you see? Can we contribute to this? And if so, how? In what ways do we make it worse?
Yeah. No parents would want to harm their child. So firstly, we want to take away that blame and guilt. You know, we are all victims of diet culture. So a lot of the narratives are being passed down to us.
Yes.
Without that awareness, we will continue to live with that messages. And not every teens live with these messages, develop an eating disorder.
Yeah.
You know? So we do see parents as ally, as a source of support, not really a source to blame. So no matter what, you have been the expert of feeding your child all their life. Even if they have an illness now, think of it as an illness that you are trying to help them nurse and recover from it.
Yeah.
And in this particular case, you just need a team to help you.
Yeah.
You know, professional team to help you.
Yeah. Yeah. And how often do you find that teens do recover? That they go through this, they do use it as a coping mechanism, but actually can they get better? Or is it something that you see as more of a kind of a chronic illness that every time they go through a stressful event in their lives that they'll, go back to using it as a coping mechanism?
Yeah. People can recover. And the earlier the intervention is, the higher chance of recovery. So dragging this out into adulthood is definitely going to make it harder because of how fixed your brain has become. Now their brain is developing. If you re-nourish that, they can actually recover pretty well.
Great.
But if you have life stressors all your life, you can't really predict that, and you don't develop enough healthier coping as an alternative, this can be very tempting. Something that you know is familiar, is comforting. People do relapse as well.
Yeah.
And the key factor usually is dieting.
Right.
So people who are able to, or they're willing to let that go completely, they have a much higher chance of just staying well, maintaining well. Yeah.
And how do you work with them to kind of let that go? Because as you said, diet culture is everywhere and has been so for many, many years. It's really difficult. You might feel like you want to let it go, but society as a whole doesn't.
Yes.
It still really kind of praises thinness and being thin. So it's difficult when, you must have that child in front of you and you're working with them and you feel like, right, we've got somewhere, but actually then you're letting them go back into the world again where diet culture is all around us. So how can you kind of manage that?
It's really hard because as teenagers, we talk about that reflective self-consciousness being really high, and also the instinct to want to fit in is really high. They will want to do anything to fit into what's on the outside, what's being told. And developing that self-trust and that security within themselves is really the key. Other than your appearance, what are you good at?
Yeah.
What are other things that you feel like you are good at that no one can take that away? It can be sports, it can be arts, it can be music, it can be helping other people, it can be small projects that you're doing, that's contributing to the society.
Yeah.
So we kind of expand that life lane other than just focusing on appearance. Yeah, it takes time, I would say.
Yeah, but it is possible.
It is possible.
Let's just talk briefly about boys, because I'm sure there are some mums listening who are mums of boys. I think there is a myth that eating disorders only affect girls, but that's not true, is it?
Not at all. I've seen boys, I've seen men actually struggling with this, and they're so ashamed to come forward because they think that this is a female disorder. Actually, in Singapore, it's the first study. It's the first study on the prevalence, estimation of prevalence of eating disorder. Yeah. And they found that actually the ratio is about 1-to-1.
Wow. Yeah. Okay. Wow.
For male and female.
And is that for teens in particular, or is it just for across all ages?
For adults.
Right, okay.
Yeah. So they studied 800 adults to look at what are the prevalence for different type of eating disorder. They also found that the other specified feeding and eating disorders being the biggest group, and 20% almost of the cohort are at risk of developing an eating disorder.
Right.
But only 1.6% is currently seeking treatment.
Wow.
Yeah, it's a very
that's such a small number, isn't it?
Yeah.
And do you feel that that's because it's easier to mask as a boy? Do you feel like, boys tend to present more with wanting to go to the gym and the protein shakes and that type of kind of healthy eating type thing, which maybe goes unnoticed by parents?
Definitely.
Yeah.
And when they're trying to lose weight, they're striving for leanness. And it's so normalized, for teens to go to the gym, to eat less, to count their micro.
It's a great shield, isn't it? It's a great way to kind of hide, you've actually got a problem behind this kind of extreme healthy eating. Yeah, exactly.
Definitely.
I'd love to move on to how we as parents can try and help our girls and our boys develop more of a positive self-identity and increase their self-esteem. Is there a way, is that something that's just inherent to children, that you're either lucky or you're not, or is it something that we can do? Can we do something about it?
Of course. Yeah. Of course. It's nature and nurture, right? Some kids, they're already naturally built with that easy, calm temperament. Some are a bit more anxious, shy, timid temperament. But in terms of nurture, what you can do is the relationship with them. So if you think about friendships, that's secondary in their life. You are the primary relationship, and they spend most of their life with you before they have these friendships in their teenage years. So if you're able to help them feel loved, accepted as who they are, cared for, you don't need to be perfect. Just as much time as you can, or more of the time than less, you can help them feel that way. That would be really helpful.
And is that with praise? Are we doing that,
right. No, not necessarily.
Okay, how are we doing that?
Yeah. I think showing your love is not supposed to be dramatic, like grand gesture.
Right.
But acceptance in the smaller moments when they're not being their best.
Okay.
One theme that I notice is we are always rushing, and sometimes they feel like I'm slow, I'm dumb, I'm not, important. From these moments, like I'm rushed to fit into my mom's schedule or everyone's schedule, and they're the overlooked one. I'm slower in wearing my shoes or putting my clothes on. For example, those moments are what people tell me sometimes, not dramatic abuse, but just small moments like that. Yeah. So feeling accepted is a very important one, because they would want to please you.
Yeah.
Whatever you say, whatever you praise them might become the expectation of themselves.
Yes.
What they think they should be doing.
Yes.
But we also want to help them be curious about what they want, what they like about themselves. Instead of just praising that based on your view, what do you think about this? What you did here? What you like about that?
Yes. Yeah.
So the ability to be able to say what you're good at, we don't develop that. We just train them to receive.
Particularly girls. Never, it's all about humility and, dampening down our own achievements. We never are open about, I'm actually really good at maths, or I'm really good at running, or it's not something that as girls we're really taught to do.
When you ask them, they might tell you what others tell them.
Right.
Rather than what they really think about themselves.
Right.
And then they start to use that as what I should be doing, and then they run with it. And then they realize, actually, I don't like this at all.
Gosh,
as teenagers, and they're lost. I don't know what I want to do now.
Yeah. So do you feel that that's the way praise can go wrong? If you actually, you're imposing your view on them, and actually it's setting them up for expectations which may not be aligned with what they feel about themselves.
Yes. Of course, you need to praise things like values that you hold as important as a family. But we don't want to overdo that, or just, use labels like you're so pretty, you're so smart, you're amazing, and vague praises like that.
It's so hard not to do. When you do think you are so pretty, you are so amazing.
Yeah.
It's so hard.
You believe in it.
Yeah,
and you
I
feel
do
it.
believe in it, yes. So it is so hard to restrain yourself from doing that.
I don't think you need to. It's just balancing that out and add more phrases that are more specific.
Okay.
Like effort of them overcoming a difficulty and challenge.
Yes.
We actually don't feel confident when we are good at something, but how we overcome adversity and helping them reflect on learning points. What did you do that helped you? You know, what are you proud of in this moment? Highlighting those. Yeah, I think they already know they're good.
Yes, true.
Those moments when we praise them.
They can feel it. Yeah.
So you're asking about how parents can help them develop self-esteem. We talk about helping them feel accepted, loved as who they are. The second point is to be able to express themselves freely.
Yeah.
So the more they're able to feel safe enough to express their thoughts and their feelings to you, you have a higher chance of developing someone with good self-confidence.
Yeah, absolutely.
And also able to hold their ground later on in friendships, in relationships. That's true connection, you know, and true belonging.
And if you are a parent who feels like, for whatever reason, at some point in your life, you have rushed them. You know, you have been that mum, come on, or, you know, why did you do that? Or, you know, as you said, none of us can be perfect. And sometimes we have had those moments which we're not even proud of. And you're sitting with a child who has developed a mental health challenge. How can we kind of repair that? How can we make it better? Can we make that connection and boost their self-esteem, even though we might not have the foundations that we hope for?
Yeah, definitely. Yeah. In the rupture and repair framework that's rooted in attachment theory, they found that repair is actually so much more impactful than the rupture and has so much more influence on the relationship. Nobody will tell you that they grew up without their mom yelling. You know, that's just not possible, unrealistic. But they might not tell you that my mom don't love me, you know. It's the repair and other moments where you feel loved and accepted. It's the balance. If you have more of that moments, positive experiences, then your mom rushing you and yelling you,
it doesn't have the negative impact.
Yes, it will buffer the impact for sure. If you feel loved and accepted in most time with her, the yelling and the rushing may feel less impactful. Yeah. So always focus on repair. A lot of parents feel that I shouldn't be saying all these things, especially Asian parents. You know, they appreciate that. Yeah, and that's also a learning opportunity for them to learn that all relationships, close relationships like this can have ruptures, but it can all repaired. That's part of developing that safe attachment and security.
And how much of our own kind of thoughts about our own body, our own self-esteem, our own body image impacts on our children?
I think it would. And you cannot always be on the guard and be mindful about what you say. We just try to be careful and do our inner work, I would say. Like, for example, ask yourself, what are your beliefs about certain body type? What are your beliefs about food, certain type of food? Messages that you have received all your life. And think about what are those that you want to maybe protect your kids from. Yeah.
And it might be that you only actually realize that you have those thoughts, that they're a problem when your child starts expressing negative feelings about the way they view food or their body, and you think, maybe this has come slightly from the way I have talked about food all their life or have talked about my own body. I mean, I wonder whether, do you ever get to a point where you feel like actually it's helpful to have some family therapy, or some of the parents might need some help when they uncover some issues for themselves?
Definitely. A lot of parents, they didn't realize the impact until their daughters, their boys take it too far, you know? So then they reflect, actually, I have been doing all of this all my life too, even though I don't develop an eating disorder. They are just on the spectrum. Maybe the disordered eating part. And some of the teens, they tell me all their life they remember their parents dieting, exercising with a fixed routine.
Yes.
The mom checking on themselves,
The weight,
looking at the mirror,
Mm-hmm.
complaining about their belly, all of that.
Yeah.
And that's the memory they have.
Yeah.
Yeah.
And we were talking about healthy eating and, you know, social media and stuff like that. And I think there is so much pressure on mothers, so much pressure on what you feed them. There, you know, there's so much shaming if your child is overweight. So there is an awful lot of pressure on mothers in particular. And I think sometimes that can lead into wanting to be healthy. You know, you want your family to be healthy. You want to make sure that you're feeding your children the right foods. But then does that have an effect if you're saying, no, that's not healthy, don't eat that. Oh, what are you doing with that chocolate? Give that to me. You know, will that have an effect?
Of course, of course. We need to reflect ourselves. How much we're doing here is for us to feel good as a parent, or is it really for your kid? Because they are growing, they need food, and they don't see food as good or bad yet, maybe.
Yeah.
But we are actually teaching them because we feel stressed about the judgment,
Yes.
what our friends would say. So the impact of social media, the comparison that we talk about, is also on parents. It's not just on teens.
Yeah.
Yeah.
Do you think social media can ever be positive for teens? I mean, I think so many parents are, you know, in that battle at the moment. No, you can't be on TikTok, or I really, really want, all my friends are on it. You know, where do you think it's not going to go away?
Yes.
Often parents are on it themselves.
Yeah.
But we've talked about some of the negative effects on it. What's your advice for parents with social media?
I would say curate the accounts they follow. I have teenagers who only follow their friends.
Right.
And some celebrities they admire. And I know that they are spreading positivity and not the pro-anorexia or distorted perception kind of content.
Yeah.
So they are seeking inspiration from those accounts.
Yeah.
So if you can, I would say, to introduce social media, but also teach them social media literacy. Like the things that you show, you post it, will be there forever. Would you want to keep them there? Maybe in future, your boyfriend might see that, or you know, your future employer when you maybe apply for university and they start Googling you. Do you want them to see this?
Absolutely.
You know, that kind of stuff.
Yeah.
And also never give it out as a free thing, like giving it freely. I remember when I was introduced a phone back then, I have to put that outside of my bedroom.
Right.
And there's no password on it. And kids nowadays, they have their phone in their bed.
Yeah.
And they're in a totally different world that is limitless. You can protect them in their physical space, but you cannot protect them on the online world, you know?
So is the answer for parents just actually it's better just to not let them do it at all? Or do you feel
Depends
like
on
there
their
is
age.
some benefit to allowing them, but in a very controlled way? And if so, what age do you think is the best age to introduce it?
I think kids nowadays, they have their phones as young as like 7 and 8. We do want to provide what's normal for them because socializing involves connecting online now for them, and they want to feel included. But I would say it depends on at what age they are. We can slowly let them earn that freedom. But if you're 13, for example, I would definitely not let you have your phone completely.
Right.
And even if you have that, it would be with limited hours and then no password.
Yeah.
And I get to check what you are accessing online. And I get to ask you about it.
Yeah.
And you have to be honest and tell me about it.
Yeah.
I'm looking out for you.
Yeah.
You know?
Yeah.
Yeah.
And what age would you just allow kind of free use of it and say, you know, I've taught you what I've taught you about the social media literacy. I trust you. I need to give you a chance. You will be gone soon. What age do you think that is appropriate?
I think 1-2 years before they leave the nest fully.
Yeah.
But it would be with review. There's still positivity on social media, like, you know, the Women Handbook.
Yeah.
You can still learn a lot on social media.
Thank you for that plug.
Yeah. I think you need to teach them how to use social media, not really be a controller.
Yeah.
So there are different phases. In the beginning, you might be controlling a bit more or guiding a little bit more, but you want to teach them how to view social media, which comes with the literacy, because when they're younger, the self-control is not developed. Their prefrontal lobe is not developed fully. It's not their fault. They just need you to be that police a little bit. But later on, it's not about controlling anymore, but giving them the skills to make better judgment. Critical thinking. You can discuss the contents that you see together and what they think, and then you can see what are they like. Yeah, because you can never protect them from this anymore.
Not forever.
Yeah.
Saddest thing.
Yes.
Thank you so much, Annelise. We're coming to the end of the podcast now. Can I just end with our couple of staples that we always do? So, as a psychologist, how do you look after your own mental health?
I make sure, this is a little bit lame. A lot of people don't think of it as a self-care, but I make sure I have 7 hours of sleep every day.
No, that's not lame. That's really important. That's amazing.
Yeah, that's
do you
really
manage
important. I do.
Yeah,
yes,
you're quite strict.
As much as I can.
Yeah.
Yeah, I have the privilege of being flexible. So I do know that a lot of people may not have that.
Yeah.
I do take naps as well.
Do you? Oh, I love that.
So other than sleep, I have 1.5 hours lunch break.
Yeah.
So sometimes I have like 15 minutes of a power nap.
What an amazing clinic you were. They're really practicing what they preach there, aren't they?
Yeah.
Like focusing on their staff's own mental health. That's amazing. And then we have a TWH book club where we recommend books that have either challenged us in some way or changed our lives that we might recommend to our listeners. Have you got a book for the book club?
Yes, I have 2 actually. So they're both big on social media as well.
Yeah.
So that's also where the positivity come from.
Yeah.
So the first one is Dr. Becky. Good Insight. So you can check out the book or you can check out her Instagram. Yeah. And Dr. Stephanie. Yeah. So depends on what age your teenage girls is. You can choose between these 2.
Okay, awesome.
Yeah.
Any takeaway messages for the listeners on anything that we've talked about today?
I would say it's never too late to start. Whatever that we talk about today, no matter where you were, your foundation, you could be held back by your own health, by your own marital issue, financial stress in the family. It's never too late to reconnect with your teen. Yes.
Great. Awesome. What a great message to end on. Thank you so much for coming. It's been a great conversation. I think we could probably have so much more time chatting about it all. Maybe we'll do another one. Thank you so much for listening. I'm Dr. Natalie Hutchins from the Women's Handbook.